I have Jeff Kotterman on the call right now. Jeff is a sports nutritionist. He works out of San Diego. We share our clinic together in Claremont Mesa, and we've been doing awesome programs for people by combining injury recovery programs with personalized nutrition, and that combination has worked out great. So I'm really excited to bring you on right now, Jeff.
Excited to be here, Dr. Mark. This is fun. We're just talking shop. You know, we're talking about what we love to do. So I'm happy to talk about it. We could talk about this all day.
Absolutely, it's what we do. And my office is right next to yours, although I'm at home right now. But you know, most of the time we just pop in and talk nutrition, talk physical therapy, talk injury recovery to basically maximize the outcomes for our clients. So
Yes.
what's your background, Jeff? Explain people a little bit more about what you do and how you've gained experience in this field.
So I started off as a personal trainer. I was a veteran with an exercise science degree, health degree, teaching credential, and I was set up to be like a health teacher in a high school. But I didn't want to do that. I wanted to teach nutrition and exercise, and as a health teacher, you teach all these other things in the high school level. You teach, when I got out of the Marine Corps in 1993, the big thing was AIDS awareness and STDs and drug awareness, and you're teaching hygiene. And I wanted to teach nutrition and exercise. So I started my own personal training practice. When I got out of the Marine Corps, I had my degree, and it failed miserably. I was in Pensacola, Florida, loving life as a vet, and I just concentrated on the workout. I didn't ask people how much sleep they got. I didn't ask clients what they were eating, if they were stressed out. I was just focused on that hour session and making sure that it was physiologically correct. And you know what? My business failed miserably. So I figured, what am I doing wrong? How come my clients aren't getting results? And I realized that no matter how perfect I made that 1 hour a day, that in 23 hours, they could completely undo it and do more if I didn't concentrate on the other part of the program, that was nutrition. So I went back to school, did some postgraduate work in nutrition, found a group of people that had this idea about forming this organization called the National Association of Sports Nutrition. And I was there from the get-go, taking certifications, involved with curriculum. And so I became what's known as a licensed sports nutritionist. And that was back in 96, 97. And the organization has been around since then. And we specialize in integrating specific nutrition into an exercise protocol. So back in 96, there wasn't anything known as a sports nutritionist that we coined the term. And we specialized in manipulating body composition, enhancing athletic performance, and improving recovery from exercise. So we did the non-medical stuff that registered dietitians weren't really familiar with and weren't really sympathetic to. A lot of registered dietitians back in the 90s weren't even exercisers. They were just medically based. Since then, things have evolved. Over the last decade or two, sports nutrition has really gone through a cycle. In the early 90s, and even in the 80s, we went through the no-fat, low-fat craze, and Gatorade and sports supplements kind of entered the market and boomed. They continue to boom. Sports nutrition supplements now, what credible and not, the cumulative industry is a multi-billion-dollar industry, and consumers can continue to buy things like functional foods and ready-to-drink sports aids and things that they think are ergogenic or that improve performance. And during that time, within the last, I'd say 5 or 6 years, there was an epiphany throughout the organization that I soon became to direct. So I'm the director of the National Association of Sports Nutrition, and then new research came out that a lot of these processed foods, a lot of even these sports supplements, even things like Gatorade, are actually counterproductive to our health, and counterproductive not only to our performance, but to our longevity and to our ability to fight disease. They actually can accelerate the likelihood that we have secondary or underlying conditions, or that we're open to more disease. And so the organization went through a major change where we started to accept a spectrum of science that was originally considered quackery, originally considered fad. and that is carb restriction, the whole spectrum from carb restriction to vegan programming. We looked at it, we analyzed it, and we found out that there are credible forms of all kinds of diet, as long as it's science-based and it's based on the individual. And then we actually hooked up with some medical professionals, Dr. Mark included, and found out that we can use nutrition preventatively, and it actually winds up being therapeutic, even though as non-medical professionals, we can't actually do nutritional medical treatment. We can do preventative programs that work better than the traditional, what you'll find in the hospital. Registered dietitians are still, for the most part, not all, I don't mean this to be a blanket statement, but registered dietitians are still kind of a one-track, eat a high-carb, low-fat diet, and we're finding that there are a lot of preventative nutritional programs that have higher fat and lower carbs, or that center around certain food groups that can actually do better than what's considered mainstream. So the National Association of Sports Nutrition now is involved in low carb, high fat programming, not exclusively, but a big part of it. Because believe it or not, and this is what we really want to talk about, processed carbohydrate, things like high fructose corn syrup and refined flours, grains, refined cornmeal, are integrated throughout all of the worldwide diet, not just the American diet anymore, the worldwide diet. And we're finding out that it is really responsible for inflammation. It actually causes water retention in tissue. The whole premise of Gatorade was that you can absorb water better because a little bit of carbohydrate is going to hyperabsorb the fluid. It's going to accelerate diffusion and thus osmosis of water into the cell. And so if this happens on an accelerated level or a hyper level, then cells can actually impede healing or impede their actual function because of just overload, overswelling. And then so this had a practical application. So now I'm no longer focused on just making someone prettier, jump higher, run faster. Now we're actually reversing disease, and we're actually reducing inflammation and changing people's lives throughout the spectrum of the population. So now, rather than working with just 15% of the population, now we have nutritional practical applications that is going to really work, profoundly, for about 85% of the population. So we've seen people reverse disease, reverse diabetes, reverse heart disease, literally reverse it through traditional exercise protocol and nutritional protocol, better than medication, and better than specific, even Marc will talk about this in his own practice, but some of his therapies are better alternatives than surgery. So we're getting back to developing a practitioner through this organization. I've developed this certification, and then obviously I'm certified through the organization that I represent. But in our clinic, we actually share clients who are either in pain or have some orthopedic issue, or even have some disease they're trying to fight or prevent, and we're putting them on a nutritional protocol, and changing lives. It's really gratifying. I know, Marc, you share this passion, and that is that yes, we're making a living, and we're academically stimulated by talking physiology and talking nutrition science, getting into biochemistry. But it's really gratifying at the end of the day to see somebody walk out the door a lot happier, or a lot faster, and in a lot less pain than when they came. I've seen it with my own family. You've worked with my wife, you've worked with my son, even my daughter, and you've worked with me. I have one of your apparatus here in my chair for my back, and that, along with nutrition, has kind of had a cumulative effect. And what I think, in your experience, people are open to physical therapy. They understand it. They're open to doing specific exercises to help heal the process. but they don't readily embrace the nutritional aspect of it. And sometimes that's counterproductive. A lot of times it's counterproductive. So my challenge is to introduce people to nutritional therapies that are, well, nutritional protocol, not necessarily therapies, nutritional protocol that is manageable, doable, like they'll actually do it, and effective. They'll immediately see the results. And I'm so excited about it. I became very long-winded, but there's an explanation of what I do and
it's
where I
great.
came from.
Yeah, we share similar passions. And you know, for those of you who don't know, Jeff, you also train bodybuilders. You offer competition prep services. You get people ready because if somebody's going up on stage, they need to be at a certain body fat percentage, and there needs to be a systematic way of doing that so that way you're ready for the competition. And so you
Yes.
help people with that. And that's a high level athlete. And that's a little bit like I started my career. When I got into this field, I wanted to work with the athletes because I like to play soccer and baseball. And I had that drive. But then, like you said, there's something about helping somebody walk again, or helping them be able to do an activity that they love to do that they can no longer do because of pain or because of this persistent injury. When you can help somebody do those things, it's extremely gratifying. And that reward for me personally, and I know for you too, that being able to help somebody in that manner is just extremely rewarding. And so I personally find that more fulfilling than helping an athlete who can already do most daily activities. They're just needing to increase their performance a little bit more. But
Yes.
this approach that we're taking, doing an integrative rehab, physical therapy approach with nutrition, is seeing such better results, because oftentimes, like in my Facebook groups, for example, I'll see comments about people reducing pain simply by switching to an anti-inflammatory diet,
Yes.
or by cutting out some of the processed foods that you had mentioned. And there's some truth to that. And so it really challenged me with my biases as a physical therapist, because you want to use what you know, and what I know is movement, posture, exercise, to help people. And then now, as I started to partner with you, I saw everything that you were doing for your clients, and I'm seeing how they're also able to reduce pain.
Mm-hmm.
And
Yes.
so then if you could combine the two, then it's just that much more effective.
The interesting thing for me is that the science is not readily embraced because culturally, what we're asking people to do is different. There's nothing wrong with culturally with going out, especially during stressful times like this, where we're we're fearful of getting a COVID virus. All right, well, let's console ourselves. We can have a little ice cream. There's nothing wrong with that. We can have sweet foods and treats, and let's comfort ourselves with food. And what's wrong with having orange juice and pancakes, or orange juice and a healthy granola with some yogurt, some fruit-based yogurt for breakfast? There shouldn't be anything wrong with that. That sounds like healthy food. But then if you realize that those foods are actually exacerbating an existing condition, and you can actually be pain-free if you do your therapy and a nutritional program on top of it, then hopefully you're willing to try that. But people don't realize that 2 out of 3 women in the world are over fat. No, the other way around. 2 out of 3 men. 3 out of 4, 75% of women in the world, this is on my website, this is valid statistics, are over fat. Right? We've become complacent and accepted that being thick is normal. It's like socially acceptable. And then blood markers and things are rising, right? We're kind of moving what is an acceptable blood sugar. We're moving what is an acceptable blood pressure, because we're gradually becoming more and more out of shape because of technology, because of whatever you want to call it, and it's accepted. So to say to someone, listen, the status quo is not good. We can't be like everybody else. We have to kind of change that standard. that I think is the hardest part in what we do. So the real magic is not just in writing an effective scientific program, but it's also writing one that's doable, writing one that your client is going to accept and is going to follow to a degree of compliance to actually see results. And once they buy in, once they get to that point and say, okay, I'm going to try what you say, then it literally takes a matter of days, not even weeks, to see results. And that could be as simple as reducing processed carbohydrate, increasing fearful foods, increasing healthy fats. Wait, we're supposed to eat fat? I thought you're supposed to stay away from fat. No. Having natural fats, having things like meat, and not fearing that you're clogging your arteries or accelerating the risk of disease or mortality.
I did an interview with Joan Ifland, and she is a food addiction expert, and she was saying the same thing. She said that this isn't a matter of weeks or months for you to start to see a reduction in inflammation and changes in your brain. This is immediate. This is something that if you start to cut out some of these processed foods within 1 or 2 days, you can already start to feel the difference. And it's that the hard part is just cutting that negative feedback loop that we have in our body.
Yeah. There's like a stigma around fat, and there's kind of a acceptance of carbohydrate. Now I'm not gonna be one of those keto evangelists that say, the devil's in the devil's in carbohydrates. Stay away from that. Carbohydrates are all evil. I mean, that's too extreme to me. A healthy person can handle more carbohydrate than someone who's inflamed or sick. Right, but most of us need to monitor or reduce the amount of carbohydrate in our diet because we live in a carb-rich society. We live in a processed food society. There are people on the other end of the spectrum. The antithesis of say a low carbohydrate diet or a carnivorous diet even would be a vegan diet, and nutrition has become almost like a religion. I have clients that come in and they'll be staunch vegans, and they'll question whether I own a leather belt or whether there's leather in my shoes because that's, animal cruelty. So there is religious beliefs that are involved and there are deep-seated values that are involved in how much activity we do and how much and what we eat. And what we need to do is not convert everyone to the same religion, but show the science and the data that is undeniable and shape it around a program. I'll take a vegan and put them on a low carbohydrate, high fat diet. That's fine. It's a lot easier to do it if they choose to eat some animal product. But convincing them is the hard part. And that's what we've become skilled in. You and I have actually learned how to kind of spoon feed our clients. And believe it or not, in the last 5 years, in the 30 years I've been doing this, in the last 5 years, my compliancy level is higher than it's ever been on this kind of programming. It's actually easier to eat less frequently, right? No more are we telling people eat 6 small meals a day, measure out everything, get the scale out, make sure the portions are, make sure you're on this calorie deficit. That was 15% of the population who could really do well on that. So now from a business and marketing standpoint, we've got a greater compliancy level. We've got a wider market. We can service 85% of the population on this program, this type of programming, and greater results with less effort. I mean, that sounds like an infomercial, but it's truth, because we're using contemporary science. We're becoming very efficient at what we do, and we can evaluate and do assessments through blood work and body fat to actually predict things that are going to happen before they happen and circumvent things before they get really, really bad, right? I know you would love to have a patient that is right at the start of a tear of tissue rather than after he's beat it up and ripped it practically apart. You would rather get it in the beginning where the healing process is much more likely than when the joint is just past the point of repair. And so I would rather get somebody who's pre-diabetic, who's right at the onset of potential diabetes, than someone who's already has an A1C of 10, and they're already suffering nerve damage in their eyes, or they have neuropathy or partial kidney failure. Now the rules totally change.
Yeah,
Now you're not
that's
just
why.
trying to improve quality.
Exactly, and that's why it switches over from the more preventative lifestyle medicine, where you're working on these interventions that are to basically reduce these incidences, to reduce the prevalence of some of these conditions. Now, once they already have them, once they already have diabetes, or once they already have congestive heart failure, it's tough to reverse that. But we do hear stories of that. Like you work closely with Dr. Brian Lenskes, for example, and he has story after story of taking his patients here in San Diego off of medications, particularly off of insulin. But if we can get this in the front end, if we can reduce some of these problems before they become bigger issues, then we're going to be making a huge dent on all the problems that we have with chronic disease here in the United States. And what you mentioned about compliance, I just want to point that out, because that's really important. That's something that's really key. In fact, that's how I met you. It was through one of my clients who introduced me to see you and to get some personalized meal plans and nutrition. I was looking to get back into the type of nutrition program that I was doing when I was playing sports in high school and when I was trying to play baseball in college. I wanted to get back to that high level. And so that's why I became one of your clients, and you put me onto a low carb and keto plan. And during those few months, I was able to gain lean muscle mass while losing body fat simultaneously, which I didn't even know was possible, because all I knew before were all the articles that I had read on bodybuilding.com when I was in high school. And that's what I knew from nutrition, because we don't go over that much in physical therapy school. So a lot of what I know now is because of you pointing me in the right direction to learn more about this. And, I know personally there was a huge benefit in actually having somebody coach me and provide the framework for how many carbs, fats, proteins that I should be eating, and helping me understand this whole concept of calories in, calories out. You showed me the teeter-totter analogy with the amount of fats and carbs.
Yes.
And it was just, that blew me away, because it's seriously, even now, I still am eating differently. I'm always thinking about how many carbs and fats I eat. Like you talked about for breakfast, you would think that maybe, a bagel with some, cheese and then maybe some orange juice would be healthy, or that would be okay. But if you actually add up all those sugars and all those carbs, you're just inundating your body with so much of that. And so it just goes back to that teeter-totter analogy.
Let's clarify ketogenic, because that has a stigma to it as well. There is a spectrum of carb restriction or high fat diet. A ketogenic diet is not just eating tons of fat. Now, there's therapeutic ketogenic diets that are for people like who have epilepsy, or who are trying to reverse type 2 diabetes, high levels of type 2 diabetes, and people with brain injury, nerve damage. They might be eating a clinical ketogenic diet that's about 90% fat, and they're mostly healthy fats, right? You can eat saturated and unsaturated fat, but we're not talking about eating damaged or trans fat rich diet. That's not good for anybody. But a clinical ketogenic diet is mostly fat. Then there are other types there's targeted keto diet. There's just low carb eating, where you carb cycle. So there are people that eat very low carb, and then for a time period they go back into eating higher carb and just do the teeter-totter thing. They'll eat high carb, low fat for a matter of days or a week or even 2 weeks, and then go back down. And then there are targeted ketogenic diets where you eat pretty much low carb all day, and then have a carb meal, whether it be dinner or lunch, whatever, right after your workout, and you have your carbs just post-workout, when an insulin response is minimized and nutrient absorption is maximized. So there are various versions of this that were considered a fad or gym science, but now there's clinical data to back up that it reverses disease, not just prevents it, it reverses disease, and it also enhances performance, just like you experienced. So there are bodybuilders now doing this low carb diet. There are aerobic athletes and strength athletes that are embracing this. And if you integrate this into your practice or into your own body, you'll find that you're training smarter, not harder, and you're getting more result for less effort. And we just have to convince people. Why is it that people are more likely to take ibuprofen than they are to take turmeric? It doesn't make sense to me. One is known to have side effects in your liver. If you chronically take a prescription or a drug that's anti-inflammatory, it's going to hurt your liver. Whereas you have the product, your own active atoms turmeric works for me just as good as ibuprofen, right? I take it preventatively, but let me tell you, if I have a little tendonitis or even if I have a headache, and I know it's due to inflammation, like a sinus headache or something, a little extra turmeric takes the edge off. It works really, really well. Why isn't that accepted? That's ancient. That's old school. That's way better than, that's been around since way before ibuprofen was formulated. But yet people are more resistant to take a supplement than they are to take something from the drugstore. We have to change that. And you, as someone who's listening to this interview, I implore you to either implement it yourself or even better yet, pay it forward and share the knowledge that you learned through integrated programs like this to other people. Otherwise, we're just going to get sicker. Otherwise, not just America, but the whole world is just going to get less and less productive, more and more in need of medical attention. We're already, a little virus has paralyzed the world. You know, well, what's going to happen when 90% of us are approaching obesity? What's going to happen when the majority of America and the world is diabetic, right? We're heading in that direction and nobody believes it, but we are.
So how does inflammation specifically, how does that affect injuries? And I know you've worked with a lot of people that are dealing with aches and pains. And so you mentioned that the low carb diet and by reducing inflammation can help with that. What have you seen with addressing?
So, you are the physiological expert. You're the anatomy expert. But the way I understand it is swelling of anything needs to be reduced. Swelling is designed to protect the body. So in an acute injury, swelling protects from movement, right, and tries to kind of isolate the tissue so that it can heal. In excessive swelling anywhere in the body, either due to infection, due to injury, due to inflammatory response to irritation in the arterial walls, right? Like in heart disease, arterial atherosclerosis is the stiffening of arteries because they're inflamed and they're damaged. They're going through a healing process. Excessive inflammation causes occlusion. And occlusion is just basically the restriction of blood flow or the restriction of transfer of nutrients that influence the healing process. That also influences the regenerative process. If you're swelled up and you're trying to recover from a workout, you want to accelerate recovery and the diffusion of nutrients across cell membrane. Excessive swelling impedes that. So if we reduce that systemically, and that's just through the proper combination of fluid and meals systematically throughout the day, if we structure a meal so that our body absorbs with minimal inflammation, and in fact, if we eat in such a way that we actually cause a decrease in inflammation through, say, a certain macronutrient ratio or a certain combination of food or the absence thereof food, if we intermittently fast, we can greatly reduce the blocking or the impeding of healing nutrients, antibodies, whatever you want to call it, to that area that's inflamed and accelerate the healing and the metabolic process. So all we're doing is helping the body do what it naturally wants to do and breaking up the traffic jam. We're decreasing the flow of cars in a traffic jam. The worst thing you want to do in a traffic jam is, oh, let's just add more cars to it. No, that's just going to make it worse. So let's get rid of inflammatory foods. Make sure that they're high nutrient, low calorie, low inflammatory response foods, and let the body do what it's designed to do.
Yeah.
In some ways, even though there's been so much medical progress, in some ways, when it comes to heart disease and cancer, if you go back just 100 years or 200 years, there's a greatly reduced incidence of those things. Other things were killing us. Other germs that we couldn't defend against were killing us, rather than heart disease and cancer, which are the leading causes of death right now. Right now, those are killing us because the way we're eating and the lack of movement is accelerating or increasing the incidence or the propensity to get a cell mutation in cancer because of inflammation, or to get heart disease or some kind of cardiovascular problem or failure because there's so much inflammation. We just prevent that. We take the clock and move it back 100 years in the style of eating and the way we exercise, and it's not magic. It's just treating the body the way it was designed.
Yeah, it's understanding physiology and how the body works. If somebody's trying to recover from lower back pain, or they had an ankle surgery or a meniscus tear, or they have sciatic nerve pain, and there's a lot of studies that correlate chronic pain to these elevated levels of systemic inflammation. The inflammation is releasing histamines and cytokines and all these chemicals that are increasing our perception of pain. And the intervention could be as simple as cutting out some of the processed sugars and some of the complex carbs, and just becoming more aware of the effect of these foods that promote inflammation.
Drinking less acidic fluids, drinking more water, making sure your water is not primarily sugar-based, making sure that your fluid consumption is not primarily carbonated, making sure that you're drinking non-carbonated, hydrating fluids, right? Gatorade, the original research in Gatorade said that you accelerate hydration through things that are only about 4 to 8% carbohydrate, right? So if you drink something that's mostly sugar, you drink something that's got 30 grams of sugar in it, it's actually dehydrating and it adds to inflammation rather than adding to the fluid and adding to blood flow. It actually impedes it. Crazy stuff. And most people don't know this stuff. You know, even athletes don't know this stuff. Even physicians don't know this stuff because it's not what they're dwelling on. It's not what they're learning about. They're learning other methods of intervention. They're learning pharmaceutical methods and surgical methods, and that's what they're engrossed in because they have to keep up with that. Well, do I have time at the end of the day to now think of this alternative therapy that might cost less and be more effective, but be totally radically different than what I've learned and what I'm continuing to learn? That's the dilemma right there.
Yeah. Well, I feel this is a perfect opportunity for us to educate ourselves, and people are waking up to the fact that there's more options than what is just told to us and what we've just been instructed to do through the years. A lot of the reason why we do things is it's really dogmatic. It's because it's based on old studies, but there's new information, there's new studies out. And in fact, many times a lot of the Eastern medicine ideas and Ayurvedic medicine or things that have been done for thousands of years, now there's some scientific studies that are randomized controlled trials to actually validate some of those claims that were made by people that previously didn't have the research to back it up. Well, now we're finding that the things that have been done through history for thousands of years are turning out to be pretty accurate.
You get aha moments. Oh, they were right. Oh
yeah, okay. And then
it actually is proven to work. If people are interested in the intricacies of this, if they really want to understand the variables that influence how to nutritionally reduce inflammation or manage pain, or at least assist in that process if you're doing a physical therapy program or some kind of program, well, I am 100% for doing free assessments to anybody that's interested. And we'll give you all the tools and the actual assessment packet that you could either use on yourself or use for someone else if you want to introduce them to how to develop a nutritional program. And so that's a free assessment, and you can get that at. You mind if I put my website up there?
Yeah, absolutely. I was just about to say, at the end of every interview, you have an opportunity to share a free gift with everybody. So you've already offered this free assessment that you're willing to give people, which is extremely generous. So for somebody that's looking for some structure and some coaching and some accountability and personalization to all this, then I would definitely take you up on that.
Very good. And then one more, we're going to, I don't know, but we're going to offer one full program. It's a binder like this. After the assessment, we actually developed the nutritional program. So we actually developed targeted menus that only have foods that people like. So we're not going to, if you hate broccoli, we're not going to put it on there. If you hate salmon, we're not going to put it on there, even if it might be good for you based on the ingredients. It's got to be a doable program. And a program like this runs about $399, about $400, but we're going to give one away free simply because we firmly believe in order to understand what we're doing together, then you need to sample it. You need to actually experience it. And I believe that, one, we're going to help somebody. I want to pay it forward and give them the experience for free. But we feel like it's going to come back to us, because once somebody experiences an integrated approach like this, they're going to want to share it with someone else. Someone else is going to see their results, or they're going to relate the experience to somebody else, and we'll get referrals, or we'll get people, other practitioners, right? If you're in the field and you feel like you can be in the position to disseminate this information, then we want to give you the tools to be able to do this and help your patients and clients get better results. Because that's why we're here, right? That's what's going to sustain your business, and that's what's going to ultimately make us feel gratified at the end of the day, that, hey, we did some good, and we're doing it pretty well, even better than the other people out there. And so we're going to offer that as well.
That's very generous. Where could they access this?
So if you go to trisystem.com, TRISYSTEM.com, and click on free assessment, fill out the information right there. You'll be able to download a paper assessment, a PDF, to be able to go through. We talk about doing body fats. We talk about medical history. We talk about the pertinent information. There's stuff in there talking about the spectrum of nutrition, meal frequency. So there's a lot of free information in there on how to assess a client or a patient. And then if you fill that out, or you get online with us, then we can actually help you turn it into a program. And that's basically it. I'm excited to have somebody else in front of me so I can share this. And the cool thing is we can do it just like this, right? That this is an interview, this is a Zoom interview. So we can see clients anywhere in the world via Zoom, and we're very effective at it. So we can do an assessment, and it doesn't have to be in office. It could be cross-continent, it could be intracontinental.
Yeah, exactly. You said that you could test for body fat. You can do calculations based off of circumference. So somebody all they need is a tape measure, and
correct.
They can measure themselves at home and give you the values, and we can
even do blood work.
Magic.
We can even do blood work. We have a relationship with labs all over the country, in other countries. It's not completely worldwide, but in most states and countries, we can find a way to get blood analysis done, so we can do an integrated approach.
Awesome. Well, I know you have a virtual client waiting for you right now, speaking of which, but I appreciate your time. Hopefully people really got a better understanding of how to eat better and the importance of that, and how it can help them recover from injuries.
Yes, it was great talking with you, Dr. Mark, and let's work with more clients together.
Absolutely. Thanks, Jeff. See you later.
Bye.